Good evening and welcome to our lecture tonight. We want to focus on understanding decision making in healthcare. In this particular lecture, we are going to understand what is decision making in healthcare. We will also find out why it is important and what are the challenges that we face when we are making any decisions. We look at various trends in the healthcare industry. We are going also to look at what are the main types and models that are used when you are making decisions in healthcare. And finally, we will look at common barriers and facilitators of decision making in healthcare. So these are critical questions that we will continue to answer as we move into the lecture. And I invite you to work with me as we get to understand this very critical concept and component. Now, we are saying when we make decisions, we are actually in the process of us choosing among different options for diagnosis, different options in terms of treatment for patients, different options in terms of prevention, and also the management of healthcare conditions. So these are situations that would warrant us as a healthcare provider to be able to make critical decisions. When we are these decisions also, we need to make sure that we maximize on ensuring that patient care has been done appropriately. And we are saying this issue of making decisions in healthcare in regards to diagnosis, treatment, prevention, and how we can manage any healthcare condition is very important because, number one, it's going to ensure quality in terms of service provision, quality in terms of giving our patients the best of what we can offer in the healthcare facilities. It is also important because it is going to ensure safety of our patients. It's going to ensure we are effective. It is going to ensure that we are efficient in our healthcare deliveries. So when we talk about importance, then we are looking at importance in the aspect of quality, importance in the aspect of safety, importance in the aspect of us being more effective and us being very, very efficient in our delivery of healthcare services. And then, of course, the end goal is satisfaction of employees. And also the healthcare providers will also be happy with themselves because they have been able to do the right diagnosis, they have made the right decision in terms of treatment, prevention, and so on and so forth. We could also say it's going now to propel the healthcare organization to a way new level in terms of image, in terms of perception within the community, within a country. So it is very, very critical, the issue of decision making. Now, we also cannot survive here when we are making decisions without certain challenges. And these challenges would be involving levels of situations of uncertainty. Sometimes we may not be sure about what the future holds in terms of a certain healthcare decision we have made. For example, from diagnosis and treatment, we may not really be sure on the long-term effects of a certain drug. So we could make a decision that has implications into the future. Complexity, that means that some decisions that we make are very, very complex. You have seen wrong decision making taking people's lives and also affecting them in terms of long-term effects of their health, and therefore there are consequences if we do not do it right. Issues around trade-offs, values, preferences, emotions that come with certain decisions, and also issues around ethical dilemmas. Now, we're also saying that in healthcare landscape today, we have a huge demand of public from the public for healthcare providers to deliver high quality while maximizing on cost. Everybody wants to get the best of service in terms of health, and we are saying now this is going to necessitate the need for efficient resource utilization. When we are talking about resources, it is about how we effectively use the manpower that we have, how we effectively use the finances that we have, and effective decision making also by healthcare managers. So it is important once we make these decisions, we have been able to highlight also in terms of benefit that we are going to get. We are going to have better patient outcomes, patient satisfaction, optimized resource utilization. We have been able to mention all that. Now, we have something we call operation research models, and we are saying they involve their mathematical and statistical techniques to be able to solve complex problems and make decisions. We, at this point, when we are making healthcare decisions, we could make qualitative decisions, we could make quantitative or statistical techniques, or we could use statistical techniques to be able to make these decisions. And we are saying these kind of models are used in various purposes. So we can use some techniques, for example, to forecast patients' demand, guide in capital acquisition, and be able also to make capacity decisions, facility planning, how do we plan for our healthcare facilities, scheduling, supply chain management, that is issues around procurement in the healthcare sector and healthcare organization, and also very, very importantly, we are going to use techniques that are going to assist us to be able to take care of our quality control. And then we are going to look at the historical development of decision techniques. And we are saying the passage traces the historical development of decision making in management, beginning what we call scientific management. That was pioneered by somebody we called Frederick Taylor in the 19th and 20th centuries. And other people that have contributed in the knowledge around decision making are people like Frank and Lillian Gilbreth, Henry Gant, Harris. All these very great men have highlighted the evolution of statistical sampling. So they had great conversations around statistical information that is going to assist us in matters healthcare and decision making. And they also provided direction in terms of how do we manage quality, or how do we undertake quality control activities in the healthcare organizations. Now, we are also going to be looking at the role of healthcare managers. And we are saying that these managers include CEOs, COOs, and other middle level managers. And they are very much responsible for various strategic and operational decisions that are supposed to be made within healthcare organizations. And these organizations, or these decisions that the healthcare managers are going to be making, they are going to range from planning capacity. They are also going to range from services to overseeing supply chain management, quality monitoring, personnel scheduling, facility management. So there are a wide range of decisions on where we need the healthcare managers to come in and play their critical role. Other roles that we can be able to talk about include they are very critical in terms of strategic planning and management. Healthcare managers will also play a very critical role in terms of financial management. They are going to play a critical role in terms of quality assurance. So when we are doing monitoring, before that, we need to be assured of the kind of quality we are receiving for our goods, for example, for a healthcare facility. And also ensuring regulatory compliance, and all other affairs around risk management. So it's quite an expanded kind of a work for the CEOs and COOs and all healthcare managers. The role of information technology in healthcare also cannot be downplayed. It is very, very essential to incorporate technology, especially now in this kind of dispensation or in this era of the emergence of strange diseases. And these diseases now are ravaging countries. We are now having lots of conversation around cancer, lots of conversation around diabetes. Now we need also as countries and as healthcare institutions to incorporate information technology with our systems. And we are saying IT or information technology is going to play a very crucial role in the management of healthcare. So even at the point where we are making decisions, we need this technology. If we are making a decision, for example, patient X needs to go into an operation, we are not making those statements just from a layman's perspective. Technology has come in handy for it in terms of providing imaging services. And so that is now what is making us to say that healthcare managers are highly going to rely on IT systems to collect and analyze data for various sources. And that, of course, is going now to enable them to make very informed decisions regarding to facility location, staffing, how many staff do we need, resource allocation, and also quality improvement initiatives. So it is also a critical kind of function. Of course, as we continue, we have also to understand IT is going to come, for example, when we have health records. So healthcare facilities can be able to digitize patient health information, include the medical history of the patients. It could also be diagnosis. It could also be lab results, and also IT coming in hand in terms of telemedicine services, where healthcare nowadays is being delivered remotely because of the support of the medical equipment all around IT. Now we have various trends in the healthcare sector. These are emerging issues that have come up. One is increasing healthcare expenditures. Number two, we also have trends in terms of increasing growth in the health sector. We also have trends in terms of advancement in medical technology and information technology. And these advancements have generally contributed to improvements in patient care and longevity. We have now advanced technologies in terms of imaging, for example, and it could be able to pick out even the tiniest of issues within our bodies. So all that has been able by trends in technology. We are having conversations around MRI machines and very many other kinds of machines. And finally, another trend is increased demand for healthcare managers. So hospitals are now looking for CEOs, COOs, like you have mentioned in our previous slide, because we now want to bring a critical management aspect of healthcare facilities. When we are making decisions in healthcare, now we need various tools. And that's what we are saying here, that healthcare managers are going to require or need both day-to-day operation decisions and long-term strategic decisions. And this is going to ensure that they are very efficient, and also they ensure provision of high quality healthcare. Now, these decisions are made by relying on certain tools, and we are saying that these tools are specific methods that are borrowed from other disciplines. For example, in industrial engineering, in statistics, in operational research, in management science, and they are meant to be able to analyze, design, and implement organizational changes. Uh, Part of those tools, for examples, though we will also interact with them as we continue, we could use tools like cost benefits analysis tools. If we want to venture into any investment in healthcare, we use cost benefit analysis model. So how much is it going to cost us to bring an MRI machine into our facility, and also how can we benefit from that. Remember, these decisions are also around machinery, for example, or medical equipment will also come with maintenance costs. So when we are doing cost benefit analysis, then we are asking ourselves a very critical question in terms of understanding whether this machine is going to be sustainable when we bring it on board, or when we make a decision to acquire such kind of a machine. And of course, we have other tools like the health technology assessment, HTA. We are going to be talking about it also as we progress. We are going to be discussing factors in decision making in healthcare management. We are saying while quantitative tools are very, very essential to help us analyze data and information, healthcare managers need also to consider what we call qualitative factors. Yeah. So remember, we have talked about quantitative factors, those that are statistical in nature, and qualitative factors that are crucial in terms of also decisions include like patient preferences. It also includes things like ethical considerations and various cultural aspects. That each of these ones may not fully be captured by quantitative analysis alone, or the analysis in terms of statistical data. So we need to get to understand what is the patient's preferences in terms of medication. I'm sure you have heard people that are not very comfortable with, for example, injection. So we could carry out a facility prefer. And then we are going also to look at what we call characteristics of health, and we are saying they have different characteristics. Number one, what we call patient participation, and we are saying patients are people that are going to be playing a very active role in healthcare, so we need to involve them. That is what we are talking about when we talk about participation. We engage them in various processes from at the point where they are receiving their care, and to that particular aspect where we evaluate the effectiveness of what healthcare we are providing to them. And this is going to help us stand out as a healthcare facility. Yeah. So patients' participation is very, very critical. Number two, or characteristic number two, is what we call simultaneous production and consumption. And we are saying healthcare services are produced and consumed simultaneously. And this, of course, is going to pose a challenge in terms of quality control, unlike in the manufacturing sector, where defects can be identified before sale. So here it is a bit different. Yeah, so the production and consumption of healthcare facilities. It's done simultaneously. So there are risks that we could encounter with such kind of an activity. Other characteristics are perishable capacity, and we are saying healthcare organizations need to optimize capacity utilization. When we are talking about optimizing capacity utilization, we are talking about the word optimize means maximize. So capacity utilization, and we are doing this. We are doing this in order to avoid revenue loss from unused capacity. We also need to emphasize on efficient scheduling and resource management. And another characteristic is intangible nature of outputs. Uh, so in every process, we have what we call inputs and outputs. And when we are talking about intangible nature of outputs here, we simply mean that healthcare outputs are intangible. Some of the outputs, when you talk about intangibility, you may not really feel them or see them. And this also is going now to make it difficult to assess the quality and value immediately. It is going to make it difficult for you to assess whether an healthcare service that you have offered is of quality and is serving the patient appropriately. And of course, we have issues around patient perceptions of care quality. They are going to develop over time, and they are also influenced by various factors. Perception is simply how we interpret things. I'm sure if at some point you needed some healthcare support, maybe you consulted someone and they told you do not go to facility X or do not go to healthcare facility Z or A or B. Maybe there could be a genuine reason. Maybe that comment could also be contributed by patient's perception in regards to that particular healthcare facility. And finally, as the last characteristic, we have high judgment and heterogeneity. So that is to tell us that healthcare tasks often require high levels of judgment. So this is an area that you have to require high levels of decision making, also personal interaction due to diverse nature of patients and conditions. When we are talking about heterogeneous, it could also have the meaning of different. And so we are saying around healthcare, then we have the nature of patients is diverse. And then also when it comes to the issues of now wanting to standardize so that we can be able to serve all of them, also it could be a costly affair to on the side of the healthcare facility. From there, we will now discuss or have an introduction to decision models. So we have said decision-making models, they are critical approaches that we use in order to navigate choices and reach optimal outcomes. And in this particular area around healthcare, the decisions will profoundly impact patients' well-being. So, simply saying can make or break a patient. We can make a decision that is going to get a patient out of danger, and we could also make decisions that are going to find us losing the patient. So we have models that are going to be assisting us to be able to make this decision, and that's why it is important to use structured models. We are saying also that these models are going to provide a framework for healthcare professionals. They are going to assist us to analyze, evaluate, and make decisions based on evidence. So we are not just making pronouncements out of the blues. So the models that we intend to discuss here to be critical in terms of ensuring our evidence is concrete. We have used the aspects of critical thinking to be able to make these decisions. And we're also saying that they are going to serve as valuable tools to enhance decision making, quality, efficiency, and consistency in complex healthcare environments. We have a number of decisions making now. Examples. For example, we have what we call evidence-based decision making, or EBDM. Using this particular approach, then it integrates the evidence from research, clinical expertise, and patient values and preferences to be able to make healthcare decisions. So, this is a very critical model, and its key focus is on uh, providing solutions by ensuring that they are reusing research, maybe of a particular situation, to be able to make that decision. So with the EBDM, we are also saying we're going to emphasize on using scientific evidence to inform issues around clinical practice, the development of healthcare policies, and healthcare management. So this kind of a method is very important. For example, we could having an issue around uh, or another condition. So when we are using the EBDM model, how can we go about it? That's a critical question to need to ask ourselves. So the first thing is to be able to identify the, that is at hand that requires us to face the condition, diabetes. Then we now remember we have said it is all about research. Now we formulate a question, and that, for example, what is the most effective method or protocol to be able to manage diabetes? We can be able to ask that as we are using the ABDM model. And then we get now three. Now we search evidence. That's our main place where it focuses on getting the best available evidence. So evidence, when you of course we are in search of evidence, we could get many evidences, very many versions of information that we may need. So we need not to appraise the evidence, and we also need to synthesize the evidence to various conclusions, and then we can now practically apply the evidence. And finally, we do monitoring and evaluation to check whether the decision that we have made has been appropriate. So the key word in EBDM, or evidence-based decision-making model, is the focus on research being a core of that particular model. Then we have the shared decision model. So when we are talking about the shared decision model or decision-making model, here there is collaboration between healthcare providers and patients. And what are they collaborating about? Why are they collaborating? Those are questions that we can ask ourselves. And the collaboration is specifically to be able to make healthcare decisions that are going to align with patient values and preferences and goals. And this kind of a model will emphasize on patient autonomy. I had mentioned this model a while back, called the cost effectiveness analysis, or CEA, and it involves comparing different healthcare intervention costs and health outcomes to determine which option is going to provide the most excellent value for money. So we are looking at the cost aspect of this model, and also what is the outcome that we are going to get. And when you are using this model, decision makers around the healthcare space are going to prioritize interventions and allocate resources efficiently in order to maximize health benefits within budget constraints. So you could be able to use this method, look at what budget is at your disposal, and can this budget be able to assist us to make or to get a good outcome if we are going ahead to make a decision, maybe for treatment purposes. I also mentioned the HT briefly, or healthcare technology assessment. And we are saying this kind of a model is going to evaluate the clinical effectiveness, the cost effectiveness, the safety. So we are also emphasizing on safety aspect, the implications of healthcare technologies, we are or have adopted any of them, different kinds of treatment and different kinds of interventions. So we have really emphasized on information technology from our previous discussion. So this is a form of information technology. That's why we are calling it health technology. We are saying this of a model is going to provide evidence-based information, and this information is going to inform decisions about healthcare, technology adoption, use, and when we want to do any kind of reimbursement. We are now on the fifth model, what we call the quality improvement QI models. There are quite a number of them. We have a model under the quality improvement that we call PDSA, or Plan, Do, Study, and Act. So, for example, under planning, what are we doing there? We could be at that point. Remember, the key model is quality improvement. So, we want to improve the quality of offering or undertaking a particular treatment. So, when we are planning, for example, we can be able to, number one, define the problem. What is the problem, the healthcare problem that we want to address using the model? Then we can, from as we are continuing with planning, we can be able to set SMART goals. When we talk about SMART goals, then you know it's a key abbreviation or a key concept in planning, where we need to be specific, we need to be measurable, we need to be, it needs to be achievable, whatever we are planning to do. It needs to be realistic. It needs us to be able to be bound by a certain time. Then when we come to the D aspect, where we want now to do, so we implement various planned changes, and also we can be able to analyze or collect data. Then the S, we are saying it is for the study. So the data that we have collected, we can analyze it to see the impact, and then we can compare various results against established goals. And finally, when we are acting now, on the A, we take action to be able to refine and adjust any issues that we have seen. So under the quality improvement, we have quite a number of models that we use. The Six Sigma model. When we are using the Six Sigma model, then our aim is to improve healthcare processes by doing what we call reducing variability. And also we need to reduce any form of defects. And the purpose, of course, is to assist our efficiency and quality. Then we also have what we call the use of the lean model, also a critical model in terms of quality improvement. So we use it to be able to improve patient care deliveries, and so on and so on. I would now give you this as a quality improvement, able to talk about the total quality management, how does it work? But ideally, all these models are going to focus on continuous improvement in matters healthcare processes and systems, and they are going to involve identifying areas for improvement, implementing changes, manufacturing or measuring outcomes, and making adjustments that are based on data analytics or data analysis, like what we have seen in the PDSA method. We have also what we call operation research and management science. In this particular model, we are saying it is a quantitative method that is going to involve us applying mathematical and statistical techniques. When we are using mathematical and statistical techniques, we are focusing on what we call optimization. When we talk about optimization, then we want to take advantage or maximizing on us being very efficient as a healthcare organization or a facility. We also want to be effective and ensure quality healthcare and delivery is being done. So we also have other methods under the operation and management science, what we call the QE theory. We are using QE theory to analyze and optimize patient flow. So we are looking at what is the flow of patients in this particular facility, and we merge that by looking at the service delivery processes. For example, you find healthcare facilities that have appointment scheduling. So this is part of queuing theory, and it is meant to help us to analyze historical patient arrival patterns. That is going to be very, very crucial. And also, of course, we have what we call simulation, where we use computer-based or physical models that replicate real-life scenarios and medical procedures or healthcare systems. So, for example, under simulation, we can have what we call patient safety, and this is meant to identify and utilize patient safety. Then we have what we call these models are quite a number of them, so you need to understand the differences of each. We have what we call clinical decision support or CDSS. These ones are also computer-based tools that are going to provide clinicians with evidence-based guidelines. Remember all that we are using. The key purpose is to be able to make the appropriate decision. So provide the CDSS is going to provide different forms of recommendations, alerts, decision support at the point of care. And so this model is also very critical for healthcare providers because they are now able to make more informed and consistent decisions. Once we do that, remember what we said when we were starting, at the end of the day, it's an improvement in patient safety, and it is also going to help us enhance quality care. We also have what we call the Markov models. These ones simulate the progression of diseases or conditions over time. And we also have the queuing theory. I think I've mentioned that when I was explaining the previous slide. Key focus is to check on waiting times, and it is also to focus on how we do scheduling, for example, appointment scheduling, and we want to, at the end of the day, be able to resource utilization in healthcare systems. Then we have what we call linear programming. These models are going to help us optimize resource allocation under certain specific constraints that we might be facing in the healthcare organization. And finally, we can use models that revolve around data decision or data-driven models that are data-driven. So they leverage or they take advantage of data analysis and machine learning to be able now to inform the decisions that we are going to make. We have different types of what we call cognitive decision making models. For example, we have what we call rational, we have what we call intuitive, we have what we call recognition primed, and we have what we call we have what we can be able to say that they are naturalistic. Now, rational decision making, what does that mean? It is going to involve a logical step-by-step processes where individuals that are using this model are going to assess alternatives and make decisions based on the most favorable outcome. Yeah. So it's going to be assuming complete information and clear understanding of any consequences that might arise by making a particular decision. Rational decision making model, we have the strengths of this model is that it is logical and has a systematic approach. And it is also going to ensure that whoever is using this model uh, is able to consider all the available options before they make a particular decision. Some of the weaknesses that we are going to face include it assumes complete information. So that kind of information may not be very realistic. And of course, the model is also consuming in certain situations. Where can we apply this? When we are making very complex decisions that require a good time to be able to analyze. We can be able to use the rational decision making model. Then we have what we call intuitive decision making model. We are saying intuition is going to play a very significant role in this model. And it is going to allow healthcare professionals to make quick decisions based on their experience. So in this model, we are relying on healthcare professionals using their experience and their expertise and what we call gut feeling. And we are saying it is often employed in situations where time is a critical factor. I would want you to also do research on the challenges of using the intuitive decision making. It's a model, it's a very interesting one. We bring our expertise, our experience, and gut feelings. So find out what are the likely consequences of using this model, and also what are the benefits that we can derive from using the intuitive decision making model. Some of them are mentioned here. The strength, of course, that's going to make your decision very fast, and also is going to it is going to happen because of personal experiences and expertise. And part of the weaknesses are it could be subject to biasness or personal beliefs, and then it doesn't have a well laid out or a systematic approach. So you can find more strengths about this model, the intuitive decision making, and also more weaknesses about this kind of model. Then we have the cognition primed decision model or making model, or what we call RPD model. And we are saying this kind of a model is it recognizes patterns from past experiences. So healthcare professionals are going to match a situation that has been provided to them or that has been presented to them. They are going to look at that current situation with familiar patterns. And this is critical in terms of streamlining decision making in time sensitive scenarios. So if we do not have time, we can use what we have just said, intuitive model. We can use this one, recognition primed decision model. So this one is going to focus on uh, patterns from past experiences. Could we maybe be having similar scenarios like have been presented to us in terms of an healthcare issue? Then we have cognition primed decision making. We have talked about uh, the strengths now, it relies on pattern recognition from experience. We have brought out that in our definition. It is also very efficient in high stakes, time critical situations. Sometimes we do not have time at our disposal as healthcare providers. We need to do something very fast. We need to make a decision very fast. So these models come in handy to assist us to be able to make those very critical decisions. In terms of weaknesses, they are highly dependent on individual experience. So it means if you are new in the industry or health sector, this could be a model that would apply to you. Uh, and also it is limited in situations with unfamiliar. So you can also find out more about the pros and cons of the RPD model. Naturalistic decision-making model, we are saying healthcare professionals, when they are using this model, they leverage their expertise to make decisions that align with their natural thought processes and skills. So this kind of a model will emphasize on real-world contextual decision making. Part of the strengths of using the naturalistic model, it is going to emphasize on real-world decision making. So how is it being done, or how is it happening in real world in terms of this particular decision X that we are on the verge of making. And also it is going to consider the context and complexity of various situations. Challenges is in terms of this one, an individual who intends to use the naturalistic model as to be an expert around a particular area that they need to make a decision on. And also it may lack very structured approaches. Those areas around strengths and weaknesses are areas that I would like you to explore and be able to get more understanding of this decision making models. Then we have what we call behavioral decision making module. And we are saying it recognizes that psychology and social factors are critical in terms of influencing decisions. So now, when we are using this decision, we incorporate insights from psychology and behavioral economics. And through using this model, we are able to understand individual behaviors, biases, impact decision making in healthcare settings. Then we have what we call political decision making. We are saying in political decision making models, it is going to be acknowledging that aspects around power dynamics, organizational hierarchies, political considerations that are going to shape the decisions that we make. So when we are using the political decision making model, we are looking at focusing on internal and external stakeholders. Once we use this kind of a model, we recognize its impact on organizational politics, on decision processes, especially in large care health organizations. We also have what we call satisficing decision making model. And when we are using this model, it simply proposes that decision makers often choose solutions that are satisfactory and good enough. So this one is guided on by the element of, is the decision that we are going to make, is it satisfactory? Is it good enough? Uh, and rather than seeking a maximum solution. So this is also a very critical model that is being used nowadays. And it also balances the need for efficiency with pursuit for acceptable outcomes. We have barriers in decision making. What is going to prevent us to make the right decision? That's a critical statement or question that we need to ask ourselves. Number one is lack of clear and consistent guidelines and protocols. Remember, we have said we have some of these models that do not have a clear way of using. Number two is limited time and resources. We have seen those models that when you are not having time, what model can you use? Sometimes we could be faced with a situation that we do not have a lot of time at our disposal. The other one is conflicting values or preferences of patients, families, and providers. I mentioned about that. The other one is communication gaps and misunderstandings. And finally, we have barriers in terms of cognitive biases. Facilitators of decision making, or what makes decision making be happen. Number one is evidence-based practice and clinical decision support tools. So once we have evidence-based practice, then decision making is going to be very easy in our healthcare facilities and in the healthcare space. Shared decision making and patient engagement. So we need to engage with our patients. We call it patient participation. We need to make sure that we are participating or involving them in every step of the decision or maybe the treatment that we want to undertake. Other facilitators include interprofessional collaboration and teamwork. So we need people to come together around the healthcare facilities. If, for example, we are going in for an operation, it's not a one-man kind of an activity. So many professionals are involved. That's what we are calling interprofessional collaboration and teamwork. And also continuous education and feedback. So we can continuously send information out in terms of training, in terms of enlightening the patients on what we are doing, and thus is going to ensure that the decision that we make is very effective. And finally is on the issue of organization culture and leadership. Culture is a way of doing things. So if we want our decision to be able to work or to be the most effective or to be a good one, then we have to look at how have we been making similar decisions in a particular area. We could also be able to look at what kind of leadership do we have. Is it a leadership that is going to support the decision, or it is a leadership that is going to uh, mess up or not agree with the decision? So that is going to bring us to the end of our discussion tonight. I believe it has been of benefit to you. Kindly check those areas that I've highlighted that you need to